大家好，歡迎收睇 Plug In。今日我哋好榮幸咁歡迎約克培醫生嚟到我哋嘅節目。培醫生係嚟自多倫多大學嘅腎病學家、PKD 領域嘅傑出研究人員，同時都係多囊腎病創新管理中心嘅創始人同主任。加拿大腎臟基金會國家研究主任 Leanne Stalker 同培醫生談論咗佢畢生致力於 PKD 研究嘅事業係如何影響同改善腎病患者嘅生活㗎。冇行開，馬上為你帶嚟 Leanne 同培醫生嘅訪談，精彩內容盡在 Plug In。
I'm very pleased to have on our show today Dr. York Pei, who is a professor of medicine in the Division of Nephrology at the University of Toronto and a prominent researcher in polycystic kidney disease. Today, we will speak to Dr. Pei about his work in polycystic kidney disease and specifically about how his research has supported and improved the lives of patients with genetic kidney disease. Welcome, Dr. Pei.
Thank you.
The topic of your work is polycystic kidney disease. Could you take a minute to define what that means and what that condition entails?
So polycystic kidney disease is not a single disease. It's a collection of kidney diseases that are characterized by development of multiple cysts in the kidney. It really depends on the inheritance pattern and also the disease gene mutation underlying the disease. But broadly speaking, the most common form of polycystic kidney disease is what we call autosomal dominant polycystic kidney disease that probably account for 90% or more of the cases that we see and predominantly affecting the adults. By contrast, the recessive form of the disease, there's usually no family history because the parents are carrier. They do not have clinical manifestations. The affected individual tend to manifest generally either at birth or at early childhood and tend to be more severe than the dominant form of polycystic kidney disease.
So it sounds like this is a disease that can be highly related to your family. So how might someone know if they're at risk of developing polycystic kidney disease or recognizing that they might have the symptoms?
Usually, many patients who have a family history for the dominant form of the polycystic kidney disease, meaning that there's usually an affected parent. Recessive disease, generally there's no family history, but there may be some kind of distant cousin that may have it, and the disease pattern tend to be less clear cut unless you have a big family, so the dominant disease more easily recognized. The recessive disease, with the modern family being small and usually is picked up when an affected child has some clinical problem either at birth or in early childhood, and then the disease become worked up and then to link to a recessive inheritance pattern.
So what are the symptoms of this disease? What does it mean to a patient if they've been diagnosed? What could they expect?
So the dominant disease tend to affect and clinically manifest in adult life and resulting in kidney failure late in middle age. There may be other manifestation that is outside the kidney, such as brain aneurysm, which some unfortunate individual can rupture and then present at an acute emergency, like in a young age, or other manifestations such as the liver or other problems. But by and large, most patients will not have symptoms until they are well into mid adult life in the form of kidney failure. But before then, they could have high blood pressure, they can have kidney stone, they can have bleeding from the cysts that kind of give clues to the disease. By contrast, the recessive disease typically will manifest in the more severe cases at birth because of a problem of the child having breathing problem, and they may have to be placed on a ventilator. They may have kidney failure, and typically some of them may not survive. And the milder affected individual will tend to survive into adolescence without any problem of the kidneys, and they tend to have more problem from the liver involvement.
It sounds that even though this is a kidney disease, that it can really affect other organs and other systems in your body, which would make it really important to have a way to treat. How common is this disease in the Canadian population? Do we have any idea how many people suffer from it or are diagnosed with it?
It's very difficult to assess the true prevalence of the disease, but there are some recent kind of population-wide type of genetic study, one of which we participated in recently, and looking at the genetic mutation in a general population. And it would suggest, and it's consistent with some of the earlier literature, about 1 in 1,000 births is affected with the dominant form of polycystic kidney disease. The recessive form of polycystic kidney disease will be much less common.
Wow, so that's a lot of people in the Canadian population that are at risk of developing these symptoms. This has all been so interesting, Dr. Pei. We'd really like to find out more. Can you stay with us a little bit longer and teach us some more about your work? Stay with us, everybody. We'll be back shortly for more of our interview with Dr. Pei.
Excellent kidney health, optimal quality of life, and a cure for kidney disease. For nearly 60 years, this vision has guided the Kidney Foundation of Canada to be a collaborative, inventive, and focused leader, developing programs and services, providing research funding opportunities, and creating awareness campaigns. We've had a positive impact on millions of Canadians living with or at risk of developing kidney disease. The Foundation's research program has grown to become one of the most important sources of funding for scientists conducting kidney-related research. Within this research portfolio, the Crescent program is daring to boldly reinvent the future of kidney health research training. Collaboratively developed with the Canadian Society of Nephrology and the Canadian Institutes of Health Research, Institute for Nutrition, Metabolism, and Diabetes, Crescent successfully enhances capacity while fostering collaboration and knowledge translation for the next generation of kidney health leaders. The future of kidney research in Canada is bright. The Kidney Foundation provides much more than research funding and the hope it brings. We are grateful for the many partners and funders who help us support innovative and meaningful research and proud of our ongoing collaborations. The Kidney Foundation provides support and educational materials and builds communities so patients know they're not alone. Short-term financial assistance helps bridge gaps in resources when patients need emergency funds. Educational resources include comprehensive patient manuals and a multitude of brochures and fact sheets. Content is produced in partnership with renal and allied health professionals and distributed free of charge through renal units or directly to patients. Peer support gives patients someone to talk to who understands because of their own experience. Webinars and virtual patient forums have proven a popular and effective way to keep people up to date and connected in this unprecedented time. Kidney Community Kitchen aims to make food and cooking as easy and fun as possible for a population that has been told many foods are off limits. Our kidney community is strong. We're stronger because of the engagement and support from people like you. On behalf of those impacted by kidney disease, thank you.
And we're back with Dr. Pei. So Dr. Pei, can you let us know what made you decide to make your career studying this condition? Why is it so important to you that research is done in this area, and how did it come about?
So it was really a chance kind of by chance that I become a researcher in polycystic kidney disease. I was originally trained in clinical epidemiology and actually research in glomerulonephritis, and work with Dr. Dan Catherine, who is quite well known in the Canadian Society. And then I, as a junior staff, took a sabbatical, and one of my friends suggested I maybe learn something about human genetics. So this was in 1995, and I worked in Dr. Peter St. George Hislop's lab in Toronto. He's a very well-known researcher in Alzheimer's genetic disease. And I bring a kidney project to his lab, and at the time, the PKD1 and PKD2 genes were first sequenced, and so I work on that project. And that year was very interesting and informative, and to such an extent that I decided to spend a second year with him. And then since then, I kind of refocused my effort on inherited kidney disease, with a main focus in autosomal dominant polycystic kidney disease.
Well, I think I can speak for the community where we can say thank you to the person who thought that you should learn something about genetics, because we've been so lucky to have you in the community working towards finding out more about how polycystic kidney disease works and helping patients to be involved in their care. On that note, I'd really like to discuss the Center for Innovative Management of Polycystic Kidney Disease. Could you explain to us what this center is and what it does?
So that is a center that I started around 2015. Again, it's also by chance, because a lot of things we cannot anticipate, but it was built on the foundation of the hereditary kidney clinic that we've started about 20 years ago at Toronto General. That focuses on the care of patients with inherited form of kidney disease, but of course polycystic kidney being the most common. So 2015 marked the first time we have a drug called tolvaptan, which had undergone subsequently like 2 major clinical trials and approved for use to treat and slow down the progression of autosomal dominant polycystic kidney disease. Working with Otsuka Canada, which is a company that market this drug, they had been very helpful to support the service of risk assessment to allow us to use cutting-edge genetic and imaging method to define like who are the patients that are very likely to have premature need for dialysis, and therefore would be a good candidate for the use of this drug, and also how to use this drug in a safe way under a close monitor kind of a setting. And so we decided that this may be a time to develop a center that broaden beyond just kind of doing risk assessment and treating patients with tolvaptan, but also allowing us to support all the community nephrologists in Toronto or Greater Toronto area, and allow patients to participate in the different kinds of research projects and novel treatment. And so with that, we were very fortunate to continue on. And so this center become formally established. I also want to add that this was made possible not just with the support of the Otsuka Canada, but with the support of my division and also the donation of several patients with polycystic kidney disease.
That's amazing. So in the center, it states that they like to or want to involve patients in what they refer to as clinical decision making. Can you explain to us what the role is that they play once they're involved in the center itself?
Yeah, so maybe I should just step back a little bit to let you know, like what, other than what we have been doing, what is our model of care. And so we are currently managing as well as co-managing approximately 500 patients from the Greater Toronto area. It's a lot of patients, but many of them are looked after by their primary nephrologist. They would come to us for risk assessment so that at least for the high-risk patient, we would try to introduce them to the concept that there are potential treatment available and they have a choice. And so we try to really engage our patients, like despite having a standard set of care kind of management guideline that we would give them, we would also open the kind of horizon to like other research opportunity, whether it's related to new treatment options or maybe research to advance new tests to improve our diagnostic capacity. So they are the one that will eventually decide on the treatment plan.
It sounds like patients are really being given an opportunity to be empowered in their healthcare decisions and are really being linked to some novel opportunities and novel treatments that are being available through this center as a additional support to what they would be receiving from their staff nephrologist. Is that correct?
Yes. So, I mean, there are most of our patients, like we do have a large group of patients that we provide primary care. So I would say about 200 patients that I would look after, but the other 300 are maybe looked after by their primary nephrologist, and they would provide their usual kidney care, and then we would give them recommendations about what other advanced diagnostic or treatment options are available and provide those options if the patient and the doctor decided that would be the right fit for them.
Amazing. We have more of our interview with Dr. Pei coming up soon, so don't go anywhere.
Have you been newly diagnosed with kidney disease? Everyone's case is unique, but you are not alone. Many people can still find themselves overwhelmed when they are first diagnosed. For some individuals, it can be difficult to find answers to all the questions and issues they're facing. The Kidney Foundation of Canada is here to help navigate what living with kidney disease means for you. We can provide you with information, refer you to relevant educational resources, clinics, or other services, and offer emotional support. Check out the programs, services, peer support, and resources that are offered in your region. As a newly diagnosed kidney patient, you have just received a lot of information and it can all be overwhelming. So here's a few answers to common questions that you may have.
I have reduced kidney function. What does that mean exactly?
To be diagnosed with chronic kidney disease, you likely had blood work done that indicated your creatinine was a bit high and your eGFR was a bit low. These are the 2 kidney function tests. There are 5 stages of CKD, and all of this can be confusing. Call the local branch of the Kidney Foundation to speak to patient services staff and gain perspective on your own particular kidney situation. In BC or the Yukon, call 1-800-567-8112. The Kidney Foundation offers manuals and brochures that are available for free to either download off the website or to have mailed directly to you.
What foods can I eat?
Most meal plans for kidney patients are based upon the stage of the disease and the results of the person's blood tests. Ask your doctor if you need to limit or augment any minerals like potassium or phosphorus in your diet. You need to understand what your own nutritional needs are, and the staff at the Kidney Foundation branch may be able to assist with this. The Kidney Community Kitchen is a great online resource once you know what your dietary needs are.
Who can I talk to?
Please contact program staff at the Kidney Foundation to discuss your situation. Also, there is a peer support program if you would like to talk to someone who has been through a diagnosis of kidney disease.
How can the Kidney Foundation help me?
The Kidney Foundation have many programs and services that can help you navigate your new diagnosis. Although everyone's case is unique, remember that you are not alone. The Kidney Foundation is here to help. You may reach us by calling 1-800-567-8112.
Dr. Pei, just to clarify, are patients kept informed of the new decisions that are being made for their standard treatments of care? So when you guys make a discovery through this study, how do you communicate that to the patient community as a whole? So people who maybe aren't in the Greater Toronto area but might be interested in the new treatment options that are becoming available or that are being studied. Do you have any way to communicate that? How do we speak with our patient community about new treatment options that are becoming available?
Yeah, so we also have been quite interested to develop kind of patient-centered type of conferences. And so we have since 2000, I think either 17 or 18, I can't quite remember now, annual Toronto PKD conference that we have tried different format, but generally is pretty well full day or 2 half-day sessions in which we would invite some international experts in PKD, whether they're researchers or doctors, and a list of topics that go over different aspects of the disease, from diagnostic issues to treatment issues to diet to lifestyle and even psychosocial issues. And there are interactive forums in which the patients would potentially ask questions at the end of each presentation. And so it has been quite successful. We had 3 face-to-face conferences, but since the pandemic, everything is kind of put on a back burner. But we hoped to restart that once the pandemic wanes. This year, we had 3 virtual educational sessions that we engage different experts and but they are kind of mini symposium or educational sessions that would be in the range of 1.5-hour sessions. So they would deliver over a period of 2 months from June to recently, the last conference. So they are all kind of open. Patient can join, and there are other allied health staff such as dietitians, pharmacists, as well as some doctors. And so these are the major kind of forum means of communication that we try to provide new information for our patients.
It's great to hear that we're really doing a lot of reach out from the medical and allied health overall wellness community back to our patients and really engaging the patient community to be involved in decision making and allowing them to understand and to see where research is taking their care, because research really is what's going to lead to changes, right, into the future. Dr. Pei will be back with us shortly, so please stay with us.
Let's see. So, kidney is These are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn. I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
Dr. Pei, you were recently awarded the Medal for Research Excellence from the Kidney Foundation of Canada. The Medal for Research Excellence is awarded annually to a Canadian researcher or clinician who's recognized nationally or internationally for excellence in kidney research. And Dr. Pei is one of the newest recipients of this award. Can you explain to me what receiving this award means to you?
So I am very honored to receive this award, and it's really kind of a recognition of kind of a cumulative work over at least 20 years. And so it's kind of a validation in some sense, or recognition by the peer. And so I'm very grateful and honored. Well, I think it also really it's an honor that I want to say that it's not just my own personal kind of reward, but really it's really the team effort. Like it's not just one person that I think that is receiving this award, but I think there are many team members that had been working tirelessly for many years, and with their effort that we kind of make progress in this field. And so I want to also recognize the unsung hero, and I think it's a very positive encouragement, because researchers, we are always challenged with funding, and I could tell you like several times that I thought that I may have to fold my lab and stop researching, but somehow every time seemed at the last minute there's some good news, and some grant kind of comes through, and then you survive another cycle. And so I think that this award also speaks very loudly about the need for the research funding and the support by agencies such as the Kidney Foundation of Canada, CIHR, and PKD Foundation of Canada. And but I think that I'm really grateful for their support, and without them, I would not be able to do the work that I did.
And congratulations again, Dr. Pei, very deserving of this award. We're very pleased to have you in our kidney research community. I'm sure that all of the patients that you interact with through your center and your research are thankful to have you and your research team on the case, as it were, to make some real changes for the treatment of patients with this disease. Thank you again so much, Dr. Pei, for being with us today. It's been amazing to learn about your research journey and all the things that you're doing to help engage and empower patients in their treatments and in their research, into your research career. It's been great to speak with you today, and I think I can speak for everybody when we just say thank you for all of your dedication and your hard work. And we're looking forward to seeing what your research team learns next. So thank you very much for being here today.
Thank you.
For meat and potatoes that take place at the clinic itself. So Leanne, I just got a brand new chair, and it's wonderful, except for I'm moderately sure I needed my PhD to set it up.